Hello everyone, now let us discuss about the pharmacology of histaminics. Now let us first discuss about histamine. What is histamine? It is a basic amine formed from histidine by histidine decarboxylase. It is found in most tissues but is present in high concentration in the tissues of lungs, skin, gastric and intestinal mucosa, liver and placenta. At the cellular level, it is found largely in the mast cells. So the cells which contain histamine are mast cells, approximately 0.1 to 0.2 picomolecules per cell, and in basophils 0.01 picomolecules per cell. But non-mast cell histamine also occurs in histaminocytes in the stomach and in the histaminergic neurons in the brain. At cellular level, they are found in mast cells and basophils, and non-mast cell histamine occurs in histaminocytes in the stomach and histaminergic neurons in the brain. The turnover rate of mast cell histamine is slow, whereas non-mast cell histamine is fast. This is also an important point. And in mast cells and basophils, histamine is complexed in intracellular granules with an acidic protein and a high molecular weight heparin termed as macroheparin. Now coming to the synthesis and metabolism. It is synthesized from histidine. We know that histamine is synthesized from histidine with the help of histidine decarboxylase. And histidine undergoes metabolism in majorly two ways: decarboxylation and methylation. So in the presence of N-methyl transferase, histamine is converted into N-methylhistamine. And in the presence of MAO or monoamine oxidase, it is converted to methyl imidazole acetic acid. Whereas in the presence of diamine oxidase, it is converted to imidazolic acetic acid, imidazole acetic acid. So these are the two metabolic products of histamine: imidazole acetic acid and methyl imidazole acetic acid. And histamine is formed from histidine with the help of histidine decarboxylase. Coming to the release, as we have discussed earlier, the histamine is stored in the intracellular granules of mast cells with acidic protein. It is complexed with acidic protein and a high molecular weight heparin called as macroheparin. Histamine plus acidic protein plus microheparin. This is the complex in the intracellular granules of mast cells. So as the exocytosis occurs, free histamine is released due to the exchange of sodium ions. When exocytosis occurs, histamine is released from this complex with the exchange of sodium ions in the extracellular fluid. The sodium ions in the extracellular fluid, they exchange with histamine to release it. By this, we can get free histamine. Now let us discuss about the receptors of histamine. Mainly four types of receptors are there: H1, H2, H3 and H4. Here we will be discussing about H1, H2 and H3. First we'll discuss the selective agonist. Agonist for H1 receptor are 2-methylhistamine, 2-pyridinal ethylamine, 2-thiazolide ethylamine. Next, H2 receptors agonists are 4-methylhistamine, imaprit and impromidine. H3 receptor agonists are alpha-methylhistamine and imitate. Coming to selective antagonists. H1 receptor antagonist is mepiramine and chlorpheniramine. H2 receptor antagonists are cimetidine and ranitidine. H3 receptor antagonists are thioperamide, impromidine and clobenpropid. Impromidine is also a H2 agonist. Receptor type, all are G protein coupled receptors. H1 is GQ type, H2 is GS type, whereas H3 is GI by GO type, G protein coupled receptor. Coming to the effector pathway. Effector pathway here is PIP2 hydrolysis, IP3-DAG pathway. It release of calcium from intracellular stores, protein kinase C activation. and nitric oxide release, which leads to cGMP release. Next, coming to H2 receptor effector pathway, it is adenyl cyclase activation. It increases the cyclic AMP levels. This leads to phosphorylation of specific proteins. Next, coming to H3 receptor effector pathway, it restricts calcium influx, potassium channel activation, and this reduces the cyclic AMP levels. Now let us discuss the various distribution of receptors in the body and their mediated actions. First, coming to H1 receptors, they are located in the smooth muscle, blood vessels, and in smooth muscle, which is intestine, airway and uterus, it leads to contraction. H1 receptor mediates contraction of intestine, airway and uterus. When it comes to blood vessel, it leads to release of nitric oxide and PGI2 vasodilation, widening of gap junctions. It also increases the capillary permeability. When it comes to smooth muscles, it leads to vasoconstriction. Afferent nerve ending stimulation. It leads to vasoconstriction of smooth muscle, stimulation of afferent nerve endings, stimulation of ganglionic cell, adrenal medulla, action on adrenal medulla, it leads to release of noradrenaline, and in brain it acts as a transmitter. Now coming to H2 receptors, they are mostly present in the gastric glands, which leads to acid secretion, and in blood vessels they lead to dilation, and in heart they have positive chronotrophy. In atria they have positive chronotrophy effect, which is nothing but increase in the heart rate, and in ventricles they have positive inotropic effect, which is nothing but increase in the contraction. When it comes to uterus of rat, H2 receptors mediate relaxation, and the action of H2 receptor, they aid in the neurotransmission process. Next is H3 receptors. They are mainly present in brain presynaptically. They inhibit the histamine release and sedation. In lungs, spleen, skin, gastric mucosa, they decrease the histamine release. In ileum, they leads to inhibition of ACH release from myenteric plexus neurons, and in certain blood vessels they inhibit noradrenaline release, and this leads to vasodilation. These are some of the actions that are mediated by H3 receptor. In case of brain, presynaptically it leads to inhibition of histamine release, which leads to sedation. In lungs, spleen, skin, gastric mucosa, decrease in the histamine release is seen. In ileum, inhibition of ACH release from the myenteric plexus neurons. And in certain blood vessels, they inhibit the noradrenaline release. This leads to vasodilation. Now coming to the pharmacological actions of histaminics. First action on blood vessel. Histamine causes marked dilation of small blood vessels, including arterioles, capillaries and venules. Dilation of small blood vessels and constriction of large arteries and veins. There is a contrast. Small blood vessels, histamine leads to dilation. When it comes to large arteries or veins, it leads to constriction. And on SC injection, subcutaneous injection, flushing, especially in the blush area, heat, increased heart rate and cardiac output with little or no fall in the BP are reported. And rapid IV injection causes fall in BP. And this fall in BP is due to large doses. This fall in the BP due to large doses is completely blocked only by the combination of H1 and H2 antagonist. Dilation of cranial vessels causes pulsatile headache. This is also important point. There are certain head effect is considered as a side effect of histamine. The reason is dilation of cranial vessels cause to pulsatile headache. And large arteries and veins are constricted by histamine mediated by H1 receptor on vascular smooth muscle. Next is histamine also causes increased capillary permeability due to separation of endothelial cells, exudation of plasma. This is primarily a H1 response. Whenever injected intradermally, it elicits a triple response. Triple response is also important. Whenever histamine is injected intradermally, it elicits a triple response. Triple response is nothing but red spot, wheal and flare. Red spot is due to intense capillary action. Wheal due to exudation of fluid from capillaries and venules. Flare, that is redness in the surrounding area due to arterial dilation mediated by axon reflex. So in short, histamine causes dilation of smaller blood vessels. Whenever it is injected intravenously, this leads to fall in BP. And this fall in BP due to IV injection can be blocked only by the combination of H1 and H2 antagonist. Next is it leads to pulsatile headaches due to dilation of cranial vessels. And when it comes to large arteries and veins, it leads to constriction. This is mainly mediated by H1 receptor. And histamine also increases the capillary permeability by separation of endothelial cells. This is also a H1 mediated response. And whenever injected intradermally, it elicits a triple response, which is nothing but red spot, wheal and flare. Now coming to actions on heart. Direct effects of histamine on in situ heart are not prominent, but the isolated heart, especially of guinea pig, is stimulated. Rate as well as force of contraction is increased. That is nothing but positive inotropic and chronotropic effect. These are primarily H2 receptor responses, but a H1 mediated negative dromotropic, that is nothing but slowing of the AV conduction effect, has also been mediated or demonstrated. Coming to the actions of visceral smooth muscle, histamine causes bronchoconstriction. It causes vasodilation of smooth muscle and vasoconstriction of large arteries, and this causes bronchoconstriction. Large doses cause abdominal cramps and colic by increasing the intestinal contraction. Human uterus is not much affected, as are most other visceral muscles. Smooth muscle contraction is a H1 mediated response. Now coming to action on glands. Histamine causes marked increase in the gastric secretion, primarily of acid, but also of pepsin. This is a direct action exerted on the parietal cells through H2 receptors, and it is mediated by increased CAMP generation, which in turn activates the membrane proton pump H plus K plus ATPase. Now coming to effect on sensory nerve ending, this leads to stimulation. We have discussed in the table. Itching occurs when histamine is injected intravenously or intracutaneously, and higher concentration injected cause more pain. Effect on autonomic ganglion and adrenal medulla. These are stimulated and release of adrenaline occurs, which can cause a secondary rise in BP. Usually it causes fall in BP, and because of the stimulation of autonomic ganglia and adrenal medulla, histamine causes a secondary rise in BP. Coming to the effects on CNS, histamine does not penetrate the blood-brain barrier and no central effects are seen on IV injection. However, intracerebroventricular administration produces a rise in BP, cardiac stimulation, behavior arousal, hypothermia, vomiting, and ADH release. These effects are mediated through both H1 and H2 receptors. Now coming to the pathophysiological roles. First, effect on gastric secretion. Histamine has a dominant physiological role in mediating the secretion of HCl in the stomach. And the non-mast cell histamine occurs in gastric mucosa, possibly in the cells called histaminocytes, we have discussed earlier, situated close to parietal cells, and they have a high turnover rate. It is released locally under the influence of all stimuli that evoke gastric secretion. Histamine is released locally under the influence of all stimuli that evoke the gastric secretion. For example, feeding, vagal stimulation, cholinergic drugs, and gastrin, and activates the proton pump through H2 receptors. Now the H2 blockers not only suppress the acid secretion induced by histamine, but also markedly diminish the response to ACH and gastrin. Hence they are used in the treatment of GI tract diseases, H2 blockers. Next, coming to allergic phenomena. Mediation of hypersensitivity reaction has been the first role ascribed to histamine. However, histamine is only one of the mediators of such phenomena. Release of mast cells following antigen-antibody reaction on their surface involving IgE type of antibodies. In immediate type of hypersensitivity reaction, histamine is causative in urticaria, angioedema, bronchoconstriction, and anaphylactic shock. Histamine is a primary mediator in the immediate type hypersensitivity reaction. In this, what we need to consider is histamine plays a role in the immediate type of hypersensitivity reaction, and this is causative in urticaria, angioedema, bronchoconstriction, and anaphylactic shock. However, H1 antagonists are effective in controlling these manifestations to a considerable extent. Histamine is not involved in delayed or retarded type of allergic reactions. It is only involved in the immediate allergic reactions, and it is effective in the and H1 antagonists are effective in controlling the manifestation that are produced by histamine to a considerable extent. And the role of histamine as transmitter. Histamine is believed to be an efferent transmitter. Efferent means away from the CNS, which initiates the sensation of itch and pain at sensory nerve endings. Non-mast cell histamine occurs in brain, especially hypothalamus and midbrain. It is involved in maintaining wakefulness. The non-mast cell histamine occurs in the brain, especially hypothalamus and midbrain. And this non-mast cell histamine is involved in maintaining the wakefulness. This point may contribute to the sedative action of the H1 antihistaminics, because histamine is involved in the wakefulness, maintenance of wakefulness. Blocking of H1 receptors lead to sedative actions because of the blockage of this function. And in the brain, H1 agonism suppresses the appetite. H1 agonism suppresses the appetite, and certain H1 antagonists stimulate the appetite. Histamine also appears to act as a transmitter, regulating the body temperature, cardiovascular function, thirst, hormone release from the anterior pituitary, and possible other functions, mainly through H2 postsynaptic receptors and H3 presynaptic auto and heteroreceptors. Now coming to role of histamine in inflammation, has been implicated as a mediator of vasodilation and other changes that occur during inflammation. It promotes adhesion of leukocytes to vascular endothelium by expressing adhesion molecule P-selectin on endothelial cell surfaces, sequestrating leukocytes at the inflammatory site. It may also regulate the microcirculation according to the local needs. This is the role of histamine in inflammation. It promotes adhesion of leukocytes. It is a mediator of vasodilation. Next, role in tissue growth and repair. Because growing and regeneration tissues contain high concentrations of histamine, it has been suggested to play an essential role in the process of growth and repair. Coming to headache. Histamine has been implicated in certain vascular headaches, but there is no conclusive evidence. One of the reasons for pulsatile headache is dilation of cerebral vessels. Now coming to the uses, histamine has no therapeutic use. In the past, it has been used to test the acid secreting capacity of the stomach, for bronchial hyperactivity in asthmatics, and to diagnosis of pheochromocytoma. But these pharmacological tests are risky and absolute now. It has no therapeutic use. Previously, it is used for diagnostic purpose, but now they are not in use. The only marketed product or useful drug is beta histine. It is an orally active, somewhat selective histamine analog, which is used to control vertigo. Beta histine is used to control vertigo in patients of Meniere's disease. Possibly acts by causing vasodilation in the inner ear. And it is contraindicated. Beta histine is contraindicated in asthmatics and ulcer patients. The marketed products are Vertin, which is an 8 mg tablet, half or 1 tablet 4 times a day. Thank you for watching. Please subscribe for further videos on pharmacology and related pharmaceutical sciences.